Hello everyone and welcome to Psychology 303, Analysis of Everyday Behavior. And today we're going to be talking a little bit about some of the logistics of ABA, that is specifically how we observe behavior and how we record behavior. So both observing and recording behavior is extremely important at many points in time during the behavior modification process. So yes, we want to kind of use a technique to change behavior and then observe and record behaviors, but we also want to do that before we decide what technique we want to use. And this technique is what's known as a behavioral assessment. Whatever behavior we're interested in changing, maybe it's chewing gum, maybe it's cracking knuckles, we want to see how frequently and how intensely people do this beforehand. That way, once we implement the intervention, we can see if there's a difference between the frequency of the behavior before the intervention and the frequency after. Only with this information can we determine if the intervention is effective. And sometimes using a behavioral assessment by watching someone behave or perform these behaviors naturally, you can get a much better idea as to why these behaviors occur and maybe be able to identify some ways or some aspects of the environment or of the individual that you can use to try and tailor your intervention to them specifically. That'll help them reduce or increase this behavior. So there are a lot of different ways in which we can assess behaviors to begin with. We can use a more indirect form of assessment. This is kind of getting information secondhand, maybe asking the individual themselves, all right, how many times did you perform this behavior in 24 hours? Obviously, this isn't that reliable because people may be more likely to lie or maybe aren't paying attention to their own behaviors as much. So we try and focus more on direct observation. That's one person observing the other individual who is performing these behaviors. It's much more accurate, it's much more precise, and it's generally the preferred method. One important thing to consider with either of these methods is that you need to define the target behavior. This is arguably the most important thing you can do when starting to develop a behavioral modification intervention strategy. You need to figure out, all right, what exactly is the behavior that I want to change? So for example, if you want to exercise more, you need to be a lot more specific about what is exercise. Is exercise me walking to the fridge to get food and then walking back to the couch? Or is it running, or walking, or jogging, or lifting weights, etc., etc.? Even within all those categories, you want to be specific. All right, yes, running may be the exercise that I'm interested in, but I need to figure out, all right, how much do I want to run? Is it okay that I run 1 day a week, or do I want to run 7 days a week? You need to be very specific, especially not only in terms of what is the specific behavior you want to change, but also what is the goal that you want to set yourself for change, which we'll get into more detail about goals, but especially with the target behavior, you need to be specific. It's especially the case where you need to be unambiguous. You need the behavior to be observable and you don't need to make any inferences about internal states. Anyone who's an observer needs to be able to understand that this is what that specific behavior constitutes. Like, what is it? So there needs to be an understanding of what running is compared to walking, compared to jogging. Again, needs to be specific, and you need to operationally define this variable, this behavior. You may have talked about operational definitions in some of your research methods classes if you've taken any. Again, operational definitions are extremely important here, especially if you have multiple people observing the same behaviors, which is often extremely ideal when trying to figure out, okay, how frequently is this person behaving, especially at baseline? So ideally, you have someone else observing your own behaviors. This would be an independent observer. Oftentimes it's a trained professional, but sometimes that's just not possible. And for your behavioral modification application projects, that's probably not likely to happen. Most of you will be self-monitoring, that is, observing and subsequently recording your own behaviors. Self-monitoring is ideal for certain behavioral changes compared to others. So maybe you're better off having an independent observer for cracking your knuckles or maybe grinding your teeth, because a lot of times you're not aware that you're doing this. But if you want to modify maybe behaviors that you perform in the shower, then maybe having an independent observer isn't the best way to go about it. You're going to have to focus more on self-monitoring in especially some of these more private situations. If you do have an independent observer, these individuals should be close to the person they're observing. They should be able to identify the target behavior. So again, operational definitions are key. And they should have time to record these behaviors. And we'll talk a little bit in just a moment about what recording is exactly. But they need to have time to be able to record behaviors while still keeping an eye on you and being able to watch to see if you perform the behavior again. And that's why, for the most part, we have observational periods that we devote time to observe to see, all right, how many times or how intensely or how long do people perform the behaviors that we're interested in modifying. Oftentimes these are brief 15 to 30 minute intervals, and during this time a person records, again, frequency of behavior, strength of behavior, etc., etc. So we've kind of sectioned off a period of time to observe people, but where should we observe people? And we have a lot of options, especially as independent observers. We could observe people in their natural environment. Again, this is a more realistic and representative way of observing someone. Or we can structure the situation in a more analog environment to kind of design the situation to eliminate any possible influences of extraneous variables, weather, anything else that's going on in the situation, to focus in on this specific behavior, to see how many times a person performs this behavior. And so that way we can have a better idea of how frequently a person does this. Again, there are pros and cons to each of these. A great example I have is many times I've taken my daughter to the doctor when she's sick or had been coughing a lot. And the second we get to the doctor, she stops coughing entirely. So we see the behavior occur in a more natural environment, but in a more contrived or analog environment, the doctor's office, that behavior stops. Within more contrived or analog environments, we can distinguish between structured and unstructured observation. So structured observation is where specific events occur, and then we see how a person responds to them, how a person behaves. Or they can be more unstructured, more naturalistic. So yes, we're putting them in a specific area, but we're letting them behave as they naturally would in that situation. So probably one of the most common structured observational situations is the strange situation where a child is placed into a room with a stranger. The child, infant, toddler age, enters the room with their mother. The mother leaves, and then the researchers observe to see how the child reacts to being in there with a stranger. And basically they see how the child behaves when the mother returns, to see kind of what attachment style that child has. So that's observation. Now we need to focus on, okay, we've kind of figured out where, how, when we're going to observe the person and the behaviors that we're interested in, but how are we going to record the behavior? What strategy, what methodology are we going to use to measure this behavior? Probably the most common technique that's used is what's known as continuous recording. That's when you basically devote a period of time to observing the other person and then record every instance of the behavior. And sometimes you can identify the onset and offset of a behavior. So if you're focusing on cracking knuckles, you would count how many times a person cracks their knuckles. Maybe if a person starts grinding their teeth, you would try to figure out, all right, how long of a period did the person grind their teeth during this kind of larger time frame that we've selected for this? These different types of measurements kind of hint at the fact that there are different dimensions of a behavior that we can measure. We can measure how many times it occurs, that would be frequency. So how many times do I crack my knuckles? How many times does a child pick their nose? We can measure duration. So what is the total amount of time that's been occupied by this behavior? How many times, how long does a person take to crack their knuckles? How long does a person chew gum or bite their lips, etc.? Some of these habits that people have. We can also measure intensity. So for certain behaviors, we can think about how strong or how intense is this behavior. So kicking your legs or tapping your legs or kind of bobbing your knee up and down, can sometimes be a behavior that people want to get rid of. You could measure the intensity of that. It could be just a little lift up and down of the heel, or it could be a pretty strong bob up and down of the entire leg. And last, we can have latency. This is basically the time in between behaviors. So maybe we measure how many times a person cracks their knuckles, or how long it takes them to crack their knuckles. But we could also say, all right, how frequently, or what's the period of time in between when a person cracks their knuckles? So within that 30-minute period, we might see a person do it right away, then a 5-minute wait, then again, then a 5-minute wait, and then again. This is especially helpful if you think about someone where you're trying to help them not eat as many sweets. You could measure the time in between snacking, and then after the intervention, you might see that that time period actually elongates, that people wait longer to snack after this intervention. So that could be another way of measuring behavioral change. So that's continuous recording. Another strategy, another methodology that we can use is percentage of opportunities. This focuses on all the possible behaviors that a person could perform, and then basically identifies how many of those behaviors were the specific behavior that we're trying to increase or decrease. So for example, if a person is asked a bunch of questions, how many times do they answer correctly compared to incorrectly? We would take that correct percentage, and that would be the number of times the ideal behavior occurred. Maybe a person is asked to do multiple things. How many times do they actually agree to do it? That could be an example of figuring out percentage of opportunities, percentage of time that a person performs the desired behavior compared to the undesirable behavior. We can also have product recording. So rather than focusing on the behavior itself, we can focus on the outcome of the behavior, recording the product of an action that someone takes. So instead of measuring exercise, for example, we could measure how many pounds a person loses. So again, weight loss would be the outcome or the product of the behavior that is exercise. One nice thing about product recording is you don't have to be present when the behavior itself actually occurs. But it's a lot more difficult to determine a causal link between behavior and outcome if you're not actually there to observe the behavior. Another great example of product recording would be exam scores as a proxy for study time. So again, you would imagine that there'd be a relationship there, but you're not actually observing how long a person studies, so that causal link isn't as strong as we would like it to be. Also, we have interval recording. This is when we, rather than observing a long period of time, we divide that period of time into small intervals. And then within each interval, so say we have an hour-long period, we divide it into 10-minute intervals. Within each of these 10-minute intervals, we see, all right, did the behavior occur? Or how long did the behavior occur? So with interval recording, we can have a partial interval recording. That would be, did the behavior occur at any point? So did I crack my knuckles during this 10-minute window at least once? If yes, then we would kind of check that off. We have whole interval recording. That would be kind of figuring out if the behavior occurred during the entire interval. So during that entire 10-minute period, did the person chew gum the entire time? If yes, then we check that. If not, then we wouldn't check that. So this is ideal for long duration behaviors. So if we use a partial interval recording technique for the chewing gum behavior, we would only have one. So it would be yes, but it's important information to know that they chewed for the entire time. We can also have a combination where maybe we, yes, divide the period into intervals, but within each interval we count how many times the behavior occurs. So this is kind of also known as a frequency within interval recording. Again, this can be tailor-made for specific behaviors. And lastly, we have time sample recording. This is a situation in which it's almost impossible to devote all your time to observing a person. Maybe you're a teacher in a class who wants to see if their students are behaving in different ways, but you obviously can't watch each student. So you divide the class into intervals, and then for each interval, you focus on, all right, is the person performing this behavior at the end of that period in time? Specifically, that's momentary time sample recording, otherwise known as MTS. So a great example of this would be studying behaviors. All right, at the end of this 10-minute period, is the person studying? Yes, then they're performing the behavior. Is the person studying? No, then no. And we just basically use that last little period to see, okay, is the behavior present or not? So those are the different types of observation and recording combinations that we can use. Also important is to figure out what utensils we're going to need to record. Oftentimes when you observe another person, it's simple paper and pencil, using a data sheet to record, all right, how many times is this occurring, making little marks on the sheet to represent each instance of the behavior occurring. If duration is important, then you would write the start time, the finish time, if you have a stopwatch with you. There are a lot of different forms, a lot of different sheets that you can use that will help you with all of these different methodologies that you can use to record behavior. But the big key is picking the right technique, the right method of recording and method of observation to use for the specific behavior that you're interested in. And lastly, one important thing to consider is reactivity. A lot of times when people know they're being watched by another person, they behave very differently. If they know, especially, they're being recorded by another person, and that person is trying to observe a very specific behavior, oftentimes those people, if they need to perform it, they'll do it more than they otherwise would. If they don't need to do it, then they'll stop doing it entirely. So, especially when recording baseline levels, sometimes it's important to make sure that it's not necessarily known that the target individual with the target behavior is being observed. So sometimes you have to make sure that the individual is acclimated to their environment, that they feel comfortable. Sometimes you can use video recordings of people, so they don't actually know that they're being observed, but later you can record how frequently the behavior occurs. But sometimes reactivity in itself is a technique, a behavioral modification technique. Again, if people know that they're being watched, then they're going to change their behavior into a more advantageous manner. So again, if they want to do something more, if they're being watched, they're going to do it more. If they want to do something less, if they're being watched, they're going to do it less. So observation in itself can be a way of getting people to reach their goals, to modify their behavior in the desired way. So that's all we have for observing and recording. We'll get into what we do with that information later. But thank you for your time and attention, and I will see you on the next video. Thanks.